Imagine you're 76, feeling well, enjoying life. Maybe you're spending time with your grandchildren, tending to your garden, or traveling with friends. You feel healthy, energetic, and grateful for every day. Then, during a routine checkup, your doctor suggests a few extra tests, just to be safe. It seems harmless, maybe even reassuring. After all, isn't catching things early always better? But suddenly, you find yourself sitting in a specialist's office, not because you felt sick, but because a test picked up something minor, a shadow on a scan, a slightly abnormal blood result, or a tiny lump. That one test can trigger a cascade, more appointments, more procedures, more anxiety. What started as a simple checkup now disrupts your peaceful routine, filling your days with uncertainty and stress. This isn't rare, it happens to many older adults every year. In fact, millions of seniors are swept into a cycle of testing and treatment for findings that may never have affected their lives. I'm Dr. Malcolm Hayes, and today we're talking about why routine screenings after 70 can sometimes do more harm than good. It's a topic that's rarely discussed, but it's crucial for your well-being and peace of mind. The key idea is this: after 70, the balance between the risks and benefits of screening changes dramatically. What once made sense in your 50s or 60s may not be the best choice now. Many conditions found by routine tests in older adults would never have caused symptoms or shortened your life. These are called incidental findings, things that look abnormal but are harmless. But once something is found, the medical system often pushes for action, more scans, biopsies, or even surgery, rather than simply watching and waiting. Older bodies recover more slowly from procedures, and what's considered minor at 60 can become a major ordeal at 78. Complications are more common, and recovery takes longer. One small finding can spiral into a medical whirlwind: more bills, more paperwork, and more time spent in clinics instead of enjoying your life. That's why we need what I call the longevity perspective, understanding that early detection isn't always better as we age. Sometimes, the best medicine is simply living well and focusing on quality of life. In your 50s, screening can add decades of health by catching aggressive diseases early. But as we get older, the math changes. The chance that a screening will find something dangerous drops, while the risk of harm from unnecessary treatment rises. After 70, many so-called abnormalities are harmless, and interventions can cause more harm than the disease itself. The side effects, stress, and complications can outweigh any potential benefit. That's why I'll walk you through 5 routine checks that deserve a second look after 70. These are tests that are often done automatically but may not be right for everyone. We'll talk about why the risk-benefit equation changes, share real patient stories, and give you practical questions you can ask your doctor to stay in control of your health decisions. Pay special attention to screenings 3 and 5. They surprise most people and could make a big difference in your quality of life. Let's get started. First, remember, not every test is necessary just because it's available. Just because technology can find something doesn't mean it's worth finding. Your health decisions should be based on your unique situation, your values, and your goals, not just on routine or habit. It's okay to ask, do I really need this test? Keep the longevity perspective in mind as we go through these 5 screenings. By understanding the hidden risks, you can make choices that protect your health, your independence, and your peace of mind. Let's start with colonoscopies after 75, a topic that's becoming more important as our population ages and more people reach their late 70s and beyond. If you're healthy, have no symptoms, and no family history of colon cancer, you might wonder if you really need to keep getting screened. Colonoscopies are incredibly valuable for people in their 50s, 60s, or those at higher risk, but after 75, the equation changes. The risks of the procedure itself start to outweigh the potential benefits for most people. The preparation for a colonoscopy can be especially tough on older adults. Drinking large amounts of laxatives can leave you dehydrated, weak, and sometimes even dizzy for several days. The procedure itself isn't without risk either. As we age, our bodies become more vulnerable to complications like bleeding, infection, and even perforation of the colon, which can be life-threatening and require emergency surgery. Of course, if you notice symptoms such as blood in your stool, unexplained weight loss, or persistent abdominal pain, you should absolutely get checked out. But for healthy, symptom-free adults over 75, routine screening often provides little to no benefit. Most colon cancers develop slowly over many years. If you've had clear colonoscopies in the past, your risk of developing colon cancer drops significantly, especially if your last test was normal. At this stage in life, you're statistically more likely to experience harm from the test itself than to benefit from finding a new cancer. Instead of a colonoscopy, talk to your doctor about non-invasive stool tests, like the FIT or Cologuard. These tests can be done at home, require no prep, and are much easier on your body. At-home stool tests are simple, convenient, and can help determine if you need any further testing. They're a great way to keep an eye on your health without the stress and risks of a full colonoscopy. If a stool test comes back positive, that's the time to have a thoughtful conversation with your doctor about whether a colonoscopy is truly necessary for you, based on your overall health and personal risk factors. The key is to be selective and make decisions based on your unique situation, not to avoid colonoscopies altogether, but to use them wisely. Many older adults feel a sense of relief when they switch to this approach: less anxiety, less physical stress, and a quicker return to normal life. So, if you're over 75, have an open conversation with your doctor about whether non-invasive tests might be a safer, smarter option for you. Remember, you don't have to assume another colonoscopy is always necessary. Sometimes less really is more when it comes to your health. Next, let's talk about PSA tests for prostate cancer in men, and why sometimes doing less can actually mean doing more for your health and peace of mind. The same goes for mammograms in women, especially after the age of 75, if you have no symptoms or family history of cancer. These tests are often routine, but it's important to pause and ask if they're still necessary as we get older. Most prostate cancers found late in life grow so slowly, they'll never cause harm. In fact, many men will live their whole lives without ever being affected by these cancers. Yet a slightly high PSA often leads to a cascade of further tests, like biopsies, and sometimes even treatments that come with real risks, such as incontinence, infection, or sexual side effects. All this for cancers that may never have caused any problems at all. The same caution applies to mammograms. In women over 75, the chance of finding a truly dangerous cancer drops significantly, but the odds of detecting harmless lumps or slow-growing tumors actually rise. These findings can lead to more tests, biopsies, and even unnecessary surgeries. This leads to overdiagnosis, finding things that aren't truly dangerous but still trigger anxiety, worry, and sometimes aggressive treatments that aren't needed. After 75, screening decisions should be thoughtful conversations between you and your doctor, not just automatic checkboxes on a list. Ask about your personal risk factors, such as your overall health, family history, and any symptoms you might have, and talk about what would really happen if something is found now. Would treatment actually help you live longer or feel better, or would it just add stress and side effects? Sometimes stopping routine screening is the best choice for your quality of life, freeing you from unnecessary worry and medical procedures. Of course, if you're especially healthy for your age, or have a strong family history of cancer, continuing screening may make sense. The key is to make it an informed decision, based on your unique situation. Remember, these tests aren't harmless. The emotional and physical toll can be significant, and sometimes the risks outweigh the benefits. Make sure you're being screened for the right reasons, not just out of habit or routine, but because it truly benefits your health and well-being. Talk openly with your doctor about what's best for you, and don't be afraid to ask questions or express your concerns. Sometimes, choosing less medical intervention can truly be more freedom, more comfort, and more time to enjoy what matters most. Heart stress tests are often ordered for older adults with no symptoms, just to be proactive, but for people over 70 who feel well, these tests rarely catch life-threatening problems. False positives are common, leading to invasive procedures like catheterizations or stents that carry real risks. Recovery from these interventions is much harder as you age. Sometimes the procedures themselves cause complications, bleeding, kidney issues, even stroke. If you have symptoms like chest pain or shortness of breath, get evaluated. But if you're active and symptom-free, routine stress tests aren't recommended by major heart societies. The best prevention: manage blood pressure, cholesterol, stay active, and eat well. If your doctor suggests a stress test, just to check, ask how it will change your care. Often, skipping unnecessary tests is the healthiest choice. Focus on what truly keeps your heart strong. Bone health matters as we age, but routine DEXA scans and osteoporosis medications aren't always necessary for everyone over 70. If you have major risk factors, previous fractures, very low weight, certain conditions, a scan makes sense, but for active, healthy older adults with no fracture history, repeated scans may not add value. Mild bone thinning doesn't always mean you need medication. Osteoporosis drugs can have serious side effects, and their benefits take years to show. The most effective way to protect your bones? Prevent falls, strength training, home safety, vision checks, and reviewing medications. Calcium and vitamin D can help, but lifestyle changes are often more powerful than another pill. Before starting medication, ask your doctor about your real fracture risk and the pros and cons of treatment. Focus on habits that keep you strong and steady. Make sure your care plan fits your unique needs, not just the guidelines. Carotid artery ultrasounds sound harmless, but routine screening in healthy, symptom-free older adults can cause more harm than good. Most blockages found are mild and don't need surgery, but once discovered, there's pressure to act. Procedures like stenting or surgery carry real risks: stroke, nerve injury, even heart attack. The test doesn't predict who will have a stroke. The best prevention: control blood pressure, cholesterol, stay active, and avoid tobacco. If you have symptoms like sudden weakness or vision loss, get urgent care. Otherwise, ask your doctor if the test will really change your care. Sometimes, the best action is no action. Here are 5 questions to ask your doctor before any screening after 70. What's the chance of a false positive at my age? If something is found, what are the realistic treatment options for me? What are the risks of follow-up procedures? What if we just monitor, instead of treat right away? Is there a safer, non-invasive, or lifestyle approach? Your health decisions should protect your independence and quality of life. Ask these questions and make every test count.